different from patient to patient. And sometimes it's very easy, sometimes it's very, very challenging to find an orientation. This is normal, and we can learn in each situation. If it's not as easy to see it, you have to feel it. And that you can feel it, it's most helpful to give this resistant test that the muscle makes a contraction and it releases, and it contracts and it releases. And in this changement of activity and releasing, you can feel on the most easy way also if you can't see it. So let's start again. I feel the bones, spina, umbilicus inferior. I know the muscle must lay in this area. I know laterally here it will be latissimus. This is latissimus. And you see, comes from here, goes to here. It's latissimus. I go higher and I have an impression, okay, this is latissimus, this is just skin. And from here I go middle. I'm now cranial from the umbilicus inferior, and I feel here the teres major. You can practice here, you will feel teres major, a gap, latissimus, just skin. Here it works. So sometimes you can feel these three parts very well. And I know, okay, this is teres major. Now you give resistance here. And we have to introduce our patients and to make them familiar with, okay, this press to my knee, perfect. Now internal rotation, teres major. Now you press to my finger, external rotation. Here, no activity now. I know, okay, this is teres minor, and you change again. Yes, now it's teres minor. You release, and I know, okay, teres minor, teres major. I take my finger in this position, let's say again, press here, and here you can see it once again. Teres major, other direction, teres minor. Here you can see it, it's very easy. And you change. Perfect. And between these two muscles, you release. I go to the scapula, I go caudally to the umbilicus. This is repetition, exact the same thing we made before. Once again here, perfect, and here, perfect. Okay. This is point one. If it's enough for you, this is most important thing. You take just this. If you feel comfortable with this and you want to go further, you go further. Now I know teres minor, teres major, and here will come the caput longum from the triceps. So I go again between teres major and here teres minor. I will go in this direction where I know here will be the caput longum. I have the idea. You do understand this? It's okay? Or do you need the translation?
이해 못하신 부분이 있나요? 통역 필요한 부분이 있었나요?
Who wants translation? You can follow like this? Yeah, it's great. I have the feeling you follow. It's very clear. Yeah, it's great.
Can I tell very short?
Yeah, please.
우리가 이렇게 그 사람마다 다 근육혈이 달라가지고 이거를 어디서 배울 수도 없고 해서 그거를 또 눈으로 볼 수도 없으니까 그거를 구별하기가 힘든데 어느 근육인지. 그러면 우리가 느끼기 쉽게 하려면은 계속 실습 때 했었죠. 저항 방향을 바꿔가면서 주동작용을 시켜가면서 주동작용을 시켰을 때 볼록 튀어나오고 활성화되면은 근데 반면에 힘을 뺐을 때 그 활성화가 없어지면은 걔가 제대로 잡고 있는 거고. 그렇게 해서 근육들을 다 구분을 해서 트레스 마이너랑 메이저랑 찾고 요 사이에 이제 트라이세스 롱헤드가 지나간다는 거.
Thank you. And you give again. You have to take the time. He knows now very well. It's optimal. Not too much power, not too little. It's perfect like this. I can go other direction. Yes, I'm correct. And now here in this direction is also the posterior part of the deltoideus. And to know I'm not on the deltoideus is best first to identify the deltoideus, the dorsal part. And so please lift up here. And you see with this transversal abduction we have the dorsal part of the deltoideus. I feel this muscle, I know this, I'm not looking for this part, and then I stay at the dorsal part of the deltoid. You go back down with the arm, and I go away 1 or 2 millimeters from the dorsal part of the deltoideus, and now I know I'm not anymore on the deltoideus. Okay. And I look again, yeah, I'm correct in this side, perfectly. And now I change my pressure, not in this direction, my pressure goes now in this direction to the floor. In this direction. I stay here, and please come in, no, with the arm in the elbow, yes, extension in the elbow. More and more and more. And you just feel, I can't feel anything just to this moment. And now, no, you come again, and you stay here. And now I give resistance, and you see as my finger comes up, you go down. And this is very different. There are patient extension in the elbow, please, where it starts soon. Here it doesn't start. He make all this movement with the other 2 parts of the triceps. And when I press here, he has to activate also the long triceps, and then I feel it. I feel here now the tendon of the long triceps, between teres minor and teres major. And so, yeah, it's perfect. Once again, please. And I give resistance. Here I have now. Here I have 0.2, tendon 0.3. So I can go between these 2 points, 2 and 3, and release.
자, 소면 삼각근 먼저 구분을 해야 되는데 그 제2중 방법은 여기 들어보라고 하면은 여기 들어보라고 하면은 바로 나오기 때문에 찾을 수가 있고, 그다음에 우리가 트라이세스를 찾을 때는 일반적으로 생각할 때 요 테레스 메이저 마이너 사이에 손을 넣고 이렇게 펴라고 했을 때,
And then you will.
펴라고 했을 때 그냥 가면은 이게 손가락이 압력 근육의 수축에 의해서 볼록 튀어나온 거 볼 수 없는데, 그냥 하는 게 아니고 현 상태에서 저항까지 눌렀을 때 근육이 수축되고, 그래서 치료사의 손이 볼록 튀어나오는 걸 확인할 수 있습니다. 그래서 요 안쪽에서는 포인트 2가 있고 포인트 3가 있는데 그 사이를 우리가 왔다 갔다 하면서 치료한다는 거예요.
Okay. If you don't have enough, you can continue. You can go from point 3 under the deltoideus between teres minor and major, and you can search the dorsal part of the humerus. And this is very close to the joint part, the joint capsule. And this is an unspecific technique between, we call it the spatium quadrilaterale. Quadri is 4. We have here teres minor, teres major, triceps caput longum, and humerus. And here you go in this area and you move and you try to reach very, very deep. Okay. Yeah, let's try. Please change your partner and then